Welcome to Aspire Nursing Academy. Today we are starting one of the core topics in general pathology. Chapter 1, Cellular Response to Stress and Toxic Insults. Let me ask you a simple question. What do cells do when they're in trouble? When they face pressure, toxins, or injury, do they give up immediately? No. First, they try to adapt, and that's exactly what today's chapter is about. How cells adjust, how they respond to harmful environments, and what happens when they can no longer cope. Without wasting any time, let's start the video. Lesson goals. By the end of this lecture, you should be able to define what cellular adaptation is, describe its main types, understand the difference between reversible and irreversible changes, recognize the mechanisms of injury that can lead to cell death. Let's begin with cellular adaptation. What is adaptation? Adaptation is the cell's way of saying, I'm under stress, but I will adjust and survive. It is a reversible change in size, number, type, or appearance of cells. Think of it as Plan B, the cell's survival strategy. But if the stress continues or becomes too intense, that's when adaptation fails and cell injury begins. Let's now go through the main types of adaptation. There are 4 key types every nurse and medical student should know: hypertrophy, hyperplasia, metaplasia, atypia. 1. Hypertrophy. Let's start with hypertrophy. It means the cell gets bigger, not more in number, just larger in size. Why? Because of increased workload or hormonal stimulation. Example time. A bodybuilder's muscles, that's physiological hypertrophy. A heart that's thickening due to high blood pressure, that's pathological hypertrophy. Inside the cell, proteins and organelles like mitochondria increase. But remember, no new cells, just bigger ones. Hyperplasia. Next up, hyperplasia. Now this is about increasing the number of cells, not size. The organ becomes larger because there are more cells being produced. 2 main types here: physiological hyperplasia, like the breast tissue growing during pregnancy. That's normal. Or the liver regenerating after part of it is removed. Pathological hyperplasia, like in endometrial hyperplasia from too much estrogen or HPV infections causing skin warts. Key takeaway: hyperplasia is controlled and it reverses once the cause is gone. Metaplasia. Now listen carefully. Metaplasia is very important clinically. It means one mature cell type is replaced by another mature cell type. But why would the body do that? Because the new cell can handle the stress better. Examples: in smokers, the airway's delicate columnar epithelium is replaced by tougher squamous cells. In Barrett's esophagus, acid reflux causes squamous cells to be replaced with columnar cells. The danger? If this stress continues, metaplasia can turn into dysplasia and eventually cancer. So yes, metaplasia is reversible, but it's also a warning sign. Atypia. Lastly, we have atypia. Atypia means the cell looks strange under the microscope. Might have uneven size or shape, larger, darker nuclei, irregular arrangement. What causes atypia? Chronic irritation, viral infections like HPV, genetic damage, and here's the scary part. Atypia is often seen in precancerous conditions. It may go back to normal or progress to dysplasia and carcinoma if not treated early. Now, students, before we wrap up this topic, let's go through a quick summary of the 4 major types of cellular adaptation. This table is very useful for MCQs, short notes, and Viva Prep, so listen carefully. Hypertrophy. What changes? The size of the cell increases. Is it reversible? Yes. Example, thickening of the heart muscle in patients with hypertension. 2. Hyperplasia. What changes? The number of cells increases. Is it reversible? Yes. Example, endometrial growth in response to estrogen, like during the menstrual cycle. 3. Metaplasia. What changes? The type of cell changes. One mature cell is replaced by another. Is it reversible? Yes, but only if the stress is removed. Example, lung epithelium in smokers, where the normal ciliated columnar cells are replaced by squamous cells. Atypia. What changes? The appearance of the cell becomes abnormal under the microscope. Is it reversible? Sometimes, but not always. It depends on early intervention. Example, HPV-induced changes in cervical cells, which may become precancerous. That brings us to the end of our topic, cellular adaptation. Now let's start our second topic of this chapter, cell injury. So far, we've learned how cells try to survive through adaptation. But what if the stress is too much or lasts too long? Exactly. At that point, the cell begins to get injured. What is cell injury? Let's understand it in simple words. When cells face harmful conditions that are beyond their ability to adapt, they get damaged. This is what we call cell injury. Now, the damage can be reversible if it's mild or caught early, irreversible if it's severe or prolonged, and whether the cell survives or dies depends on 3 things. How intense the injury is, 2, how long it lasts, 3, and what type of cell is affected. Causes of cell injury. Now let's go over the major causes one by one. Try to remember these. They come again and again in exams and real clinical situations. 1. Hypoxia, lack of oxygen. This is the most common cause of cell injury. Why does it happen? Either because blood supply is blocked, ischemia, or there's not enough hemoglobin, or the lungs can't exchange gases properly, respiratory failure. No oxygen, no ATP cell injury begins. Physical agents. These are simple physical forces like high or low temperatures, burns, frostbite, mechanical trauma, pressure, radiation exposure. They damage membranes, organelles, and even DNA. 3. Chemical agents and drugs. This includes poisons like cyanide, pollutants in air or water, alcohol, and some chemotherapy drugs. These chemicals disrupt enzyme activity and damage cell structure. 4. Infectious agents. You already know these well. Bacteria, viruses, parasites. Some kill cells directly, others release toxins, and some trigger the immune system to attack. 5. Immunologic reactions. Our immune system normally protects us. But in diseases like lupus or severe allergies, the immune system harms our own cells. 6. Genetic defects. Some people are born with faulty genes. Like in sickle cell anemia or enzyme disorders, the cells become weak and easily injured. Nutritional imbalances. This includes both deficiencies like lack of vitamins, e.g., excess like overeating, obesity, and related conditions like diabetes. Reversible cell injury. Now let's talk about what happens when injury is mild and early. This is called reversible injury, and the good news is the cell can recover if the stress is removed in time. But how does it look under a microscope? Morphological features of reversible injury. 1. Cell swelling due to failure of the NK pump. 2. Fatty change, especially in the liver. We call this steatosis. 3. Blebbing of the membrane, little bubbles form on the surface. 4. Mitochondrial swelling, early but reversible. 5. Clumping of chromatin due to acid buildup from low oxygen. Key point, if you remove the stress now, the cell can return to normal. But if you don't, irreversible cell injury, then the injury becomes permanent and the cell can no longer survive. This is what we call irreversible injury, and it leads to cell death. Features of irreversible injury. 1. Rupture of the plasma membrane, the cell bursts. 2. Severe mitochondrial damage with calcium deposits. 3. Lysosomal rupture, the cell digests itself. 4. nuclear changes which are easy to spot. Pycnosis, nucleus shrinks. Karyorrhexis, nucleus fragments. Karyolysis, nucleus dissolves completely. These are important microscopic signs of cell death. Once mitochondria and the membrane are destroyed, the cell can't be saved. Mechanisms of cell injury. Now let's understand how this damage actually happens inside the cell. 1, ATP depletion. No ATP, no energy. Everything fails. Pumps, enzymes, protein making. It's like pulling the plug on a machine. 2, mitochondrial damage. No ATP, and even worse, the mitochondria leak death signals like pro-apoptotic proteins. Calcium influx. Excess calcium inside the cell activates destructive enzymes. They break down its proteins, DNA, and membranes. 4, oxidative stress, free radicals. Free radicals are highly reactive molecules that damage lipids in membranes. Break down proteins, DNA, they're produced in normal metabolism, but too many, trouble. Membrane damage. Once the membrane becomes leaky, cell contents spill out and it starts to break apart. 6, DNA and protein damage. When damage to DNA or proteins is too much, the cell triggers apoptosis, a type of controlled death. All right, students, now let's make things even clearer with a quick comparison, side by side, between reversible and irreversible cell injury. This table will help you understand how we differentiate both types based on what's happening inside the cell. 1, ATP depletion. In reversible injury, ATP depletion is mild and temporary. The cell still has some energy to recover if stress is removed. In irreversible injury, ATP depletion is severe and prolonged. Energy production is completely lost, and the cell cannot function. 2, membrane integrity. In reversible injury, the plasma membrane remains intact or is only slightly damaged. It can still hold the cell together, but in irreversible injury, membrane integrity is lost. The membrane ruptures and the cell starts leaking contents, a sign of no return. 3, mitochondrial changes. In reversible injury, we see swelling of mitochondria, but it's still repairable. In irreversible injury, there is severe mitochondrial damage, including dense calcium deposits, meaning the mitochondria are dead. 4, nuclear damage. Reversible injury causes minimal or no nuclear changes, but irreversible injury leads to classic nuclear destruction. Pycnosis, nucleus shrinks. Eukaryorrhexis, nucleus fragments. Eukaryolysis, nucleus dissolves completely. These are important microscopic signs of cell death. Outcome. In reversible injury, the cell has a chance to recover and return to normal. In irreversible injury, the damage is permanent, leading to necrosis or apoptosis. Thank you for learning with Aspire Nursing Academy. If you found this video helpful, please don't forget to like, share, and subscribe to Aspire Nursing Academy